Hi, everybody. My name is Dr. Jewel Yoder. I don't know how many of you I know, probably quite a few of you, but welcome to Chemistry 220. That is Goshen College's nutrition course. Your professor this year, Vicki Miller, asked myself and I think perhaps Jewel Lehman to do a quick introductory video on why, as a nursing student, or um, would you be required to take a nutrition class? What is it that I would expect that you get out of a class like this? And so, as I've been thinking about this question, there's a few things that pop into my mind. One is, as nurses taking care of people in a hospital setting, obviously, one of the components of nutrition that we want to think about is how it impacts our electrolytes. If we're not getting enough nutrients and stuff, we're obviously paying attention to electrolytes and stuff through our patients' labs and through the IV fluids that we're giving to help correct some of those imbalances. So I would say that the fluid management and the fluid balance of human beings, as you're thinking about intake and output, are they in fluid overload? Are they dehydrated? Sorry, real-time problems here as my phone rings. The fluid balance is obviously a key portion of why you would be looking at nutrition and those electrolytes. Another thing that we think about with electrolyte imbalances can be sort of, blood gas situations of how is our patient doing as far as oxygenation and so on. And then obviously, the sicker your patient is, I come from a NICU background where our infants, we're looking at their weights and we're weighing them daily and seeing how they're trending. So obviously, paying attention to their nutritional intake for those that are extremely ill is highly important. And that gets us into this idea of TPN. And when we use different sorts of IV nutrition, or, through feeding tubes, PEG nutrition and stuff like that, of really assessing what is it that our patient needs to be meeting their nutritional balances. Is this something anatomical that they're struggling with? Do they have a mass? What is going on that's impeding their ability to eat? And so again, how are we using some of those parental nutrition type of supplements to help get our patients as healthy as they can be? And then there's just the basics of, if we look at this through a public health lens, if you're a public health student and you're taking nutrition, it's really can come down to just that access to healthy food and where are people living and what is their nutrition sources. Are they going to, Dollar General, although that's becoming, more and more of having fresh fruits and vegetables kind of available at them. And so again, how do people in our communities access food, and how do we educate people to eat healthy choices? I had a uh, doctoral student here recently that was looking at, the health of a population within the African American community in Elkhart, and kind of saying, like, how do we continue to hold our cultural preferences for, the foods that are near and dear to my heart. She was talking about her father in this situation and him having a heart attack, and like, how do I help him have the foods that are things that he grew up with, that are those feel good comfort foods, and yet how do you kind of tweak the ingredient list a little bit to have them perhaps serve in a bit more of a nutritious way? And so I think nutrition is a interesting topic, just in that it is so deeply personal to a lot of people as to what they were raised on, how they were raised, how do we value that within healthcare. So again, I'm really excited that Vicki took this class on for you all. I hope that you really enjoy it. And yes, I think as nurses, not only are we thinking of our own health and nutrition as we're working these long 12-hour shifts, we're thinking about that of our families, our kids, our loved ones, and obviously the people that we're taking care of. So again, nutrition can be really multi-factorial. So again, good luck with this class. I hope this little video has helped put into words, kind of what I would hope you're taking away from this is really, as you're talking with your patients, how are you working with them? To meet their nutritional needs, that you're not just saying to the diabetic person, you can never have sugar again, but how are we supplementing, unsweetened applesauce or Splendas or, different salt substitutes and so on to make food appetizing for people, while still kind of honoring the restrictions that they need to have. All right, take care. Have a fun class. Bye all.